My name is Augustin Fleury. I'm the Managing Director for Innovative Partnerships and Development Finance at Gavi, the Vaccine Alliance, and I'll talk a little bit about what Gavi does throughout the session. I'm very happy to be here today alongside three brilliant and innovative women who are really transforming, kind of financing for global health. And I will let them introduce themselves, with the first question. This panel is really about leveraging financial innovations, and that has been a core to our mission at Gavi, to deliver the impact that we seek to deliver for half the children in the world from deadly diseases. And our efforts in using capital creatively with a wide range of partners, including those on the panel, and across different types of capital, has allowed us to extend the value of philanthropic capital, like traditional ODA development finance. But there's a lot more that we can learn, and so we're very keen for the interactions with you, and we hope that you will be, submitting questions and engaging with the panel. We're keen to dive into some of the lessons that we've all learned in global health, and where this might take us in the future. So let me just hand over to our panelists and start with the first question to get the conversation started. Could each of you please tell us a bit about what each of you do in your role and how you're thinking about deploying your resources most impactfully? And let's start with you, Michelle, and please introduce yourself.
Will do. Hi, everyone. My name is Michelle Teo. I'm the Chief Investment Officer at MedAccess. MedAccess is an organization that was set up to try to increase access to healthcare in underserved communities. So think of it in Africa, South Asia, across the globe. And we do this in the form of financial instruments. We cover all three, which is the instruments that we cover are volume guarantees, procurement guarantees, and loans. And our main overriding aim is just to increase healthcare products, giving it delivered to people in countries, in new countries, more products, and helping support suppliers. Because the one thing that we do, which is a little bit different from some of the other organizations, is that we can do demand-side financing. So really trying to sort out or help alleviate demand risk. So if you think about it, if you're trying to bring a new product into, let's say, Africa, the risk is there because demand is quite uncertain. And if we can unlock that uncertainty, it means that people can actually try to deliver product into countries at affordable prices that make sense for the sustainability of the supplier and for the sustainability of the health system there. And I think one interesting thing that I always think about is, I also think about it from the reverse side. If I'm a startup in Africa looking to sell regionally or globally, some place like Geneva does also look like a place that might be quite risky. So we really do try to support suppliers through the whole process as well.
I'm assuming you want me to go next. Nafisa Jiwani. I head up the global health work at the U.S. Government's Development Bank, the DFC. And so we have financial tools to increase private investment into emerging markets. And so what does that mean? We've got a suite of tools, which includes loans, so debt financing. We have political risk insurance, equity, TA, and funds that we use. And we deploy that in a couple different ways across my portfolio of work. So the areas of priority that we have at DFC for Health, the first includes healthcare services and delivery, so anything that is brick and mortar delivering care. The second is around manufacturing and supply chain. And the third is this intersection of health and technology. We used to be the Overseas Private Investment Corporation, and when I came in 2019, there really was not a health portfolio. And so over the last 5 years, we've built this health portfolio at the agency. And when we started, we were at about 200 million. Today, that portfolio is 3.1 billion. And we did that, not on our own, but alongside with several partners. And some of those partners are on stage today, and so I share that because I think the only way for us to take risks and the only way for us to be innovative, the only way for us to deploy capital and the content and really change the way that we do business is to work with each other across many DFIs and many multilaterals to do that type of work. So that's the work that we do at the DFC. We have other sectors that we also invest in, of course. We have energy, we have infrastructure. We do quite a bit of work in the climate space. We have quite a bit of work in critical minerals. And OPIC's been around for about 50 years, and we just transitioned to the DFC in 2020. We're celebrating 5 years, actually, in December, which has really been exciting. And the new tools, I think, has been what has transitioned us from, where we were as an agency, where maybe we're focused on development policy, but now we're focused on development and foreign policy priorities, and we definitely make in terms of process, I think we make, I don't know how many people know this, but we actually make a return for the American taxpayer. And I share that because sometimes when people think about investment, and we think about risk capital, and do we actually make a return? We do make a return. And so there's a world in which we can be innovative and take risks and make a return.
Hi, everyone. My name is Liz Diebold. I'm Managing Director of the Skoll Foundation. First, just a little bit of a human moment. I am on fumes. I don't know what's going on, but my brain doesn't want to form complete sentences, and my recall is lacking. So just a little bit of grace for this conversation today. I see some nodding heads. Doesn't look like I'm alone. I just want to give a shout out to my colleagues who are not here with us this week, but who really represent and lead our day-to-day work in pandemics and health system strengthening. So Ben, Catherine, Kati, if you're out there, I support you. So the Skoll Foundation it's a private foundation based in Palo Alto, but we do work sort of all over the world. Our health work is focused in sub-Saharan Africa and South Asia. Overall, as a foundation, our top line goal is to sort of catalyze transformational social change by investing in, connecting, and championing social innovators, social entrepreneurs who are driving solutions addressing the world's most pressing challenges. So health is definitely one of those. As a funder, we focus in on organizations who have solutions at a mezzanine stage of growth. And as a result of that, I think just one of the ways that's important for us to operate is to just be very aware of where we play relatively in the funder ecosystem and where we don't, and to make sure that we're building bridges with folks who come before us and also folks who come after us. So we definitely, we do a lot of our pipeline sourcing from earlier stage funders to find those social innovators. And then we spend a lot of time and energy once we make a grant or investment in an organization or coalition or an intermediary. We spend a lot of time in active partnership helping to build the bridge to that next stage of capital, of funding, of investment, or even working with organizations to incorporate earned revenue into their model. Because we were really thinking about what is sustained change at scale look like. And that requires a payer at scale. And I still don't think in philanthropy we've cracked that nut of how to get there. But we do look for pathways around just connection to larger philanthropic funders or large collaborative funding partnerships and engagements like Co-Impact, Audacious Project. I know there's a Co-Impact friend in the audience here. We also invest, we have a dedicated effort to just mobilize access to government resources, whether that be local, host country governments at a national level, at a sort of county, state level, but also with multilaterals, bilateral donors, and then the global architecture there. Wherever we can, we look to leverage market capital, as well, and like I said, earned revenue. Some of the ways that we try to deploy our resources to be catalytic is with direct grants and investments. But again, we also look at coalitions and intermediaries who can either help us learn about a new space or solve some discovery challenges. And then we also recognize our relative power in the world, really. And so we try to, wherever we can, play a power intermediary or power broker role. we just, again, we know that we get invited to tables that not everyone does, and so we just try to channel, yeah, I guess you saw it in my DNA. I'm like, my colleagues who represent this work day to day are not here, so let me bring them into the room. That if we're, have the opportunity to connect with somebody at the WHO, we show up in the same way, where we are there on behalf of our partners and portfolio. So, yeah, I'll stop there.
Fantastic, thank you very much. And I just want to pick up a few words that our panelists shared, which I think set up the conversation really well. Building bridges, leveraging, de-risking, demand. I mean, this is all what this conversation is about. So let's get now a little deeper into what you do. We're coming off the heels of hopefully what is once in a generation pandemic, and hopefully. And the pandemic fundamentally shifted how we think about the financial toolkit that we need to ensure that the world can respond at scale to such events. At Gavi, working on immunizing children as fast as possible is a priority. The work that we do is the most impactful the earlier we're able to protect a child. And it protects their families, their communities, and the ability of the community to thrive. 20 years ago, in order to vaccinate as many children as fast as possible, Gavi and partners created one of the first innovative financing mechanisms in that space, which was IFIM, the Innovative Financing Facility for Immunization, which is a platform to securitize donor grants and to do what we call front-load donor funds for impact. So by selling vaccine bonds on the capital market, we have accessed billions of dollars far earlier than the donor governments could provide us. And we got early impact paid for over time. So that was one of the early kind of innovative financing instruments. COVID-19 brought a similar challenge. We all had to respond very quickly. And for instance, we worked with the USDFC and Nafisa's team, as well as the European Investment Bank, to unlock donor commitments faster using kind of front-loading facilities. And that kind of allowed us to unlock hundreds of millions worth of pledges kind of earlier. This allowed us to secure vaccine doses for the most vulnerable far earlier than we could have otherwise, and ultimately curb the impact of the pandemic. We also set up an advanced market commitment, which is another tool to contract large amount of doses upfront, and that allowed us to secure these doses at a lower price for Gavi countries. So now moving to our panelists, here is my next question for you all. The pandemic highlighted some missed opportunities in how we deploy our resources. How do you think that the pandemic affected the space and the pace and the urgency of collaborative efforts in the global health sector? How fit for purpose was our toolkit, and how has it changed the way investors, governments, and donors and other key players in global health approach the investment process today? And maybe for this question, let's start with Nafisa.
So I'm going to share a very real example. I'll share two examples, actually. The first is, during the pandemic, there was a very clear need to expand vaccine manufacturing capacity. We saw early on that India was not going to allow for vaccines to leave the Serum Institute of India, even though there were contracts in place. And I think that was really hard for that manufacturer, especially because they knew that they had so many contracts in place, but they also had a country that was in need of those vaccines. And so there was an opportunity, I think, worldwide for us to take a look and say, is this the way that we should be doing business? You have countries that are in need of vaccines. You have countries that are taking the lead in getting vaccines before anyone else. How do we fix this? At the end of 2020, DFC I think, was one of the very first, and I say this because I said it, I said something on a panel without getting an approval. But I said the US government will invest in manufacturing capacity. And then I got a call from the NIH. I got a call from Roger Glass, who oversaw the Fogarty International Center, and he said, I support you and we're gonna make this happen. And it's great when you get government support like that. And so, Roger Glass, for those of you that don't know, he helped India with getting the rotavirus vaccine in place almost 40 to 50 years ago. And so we went on this little journey of like, how do we start to expand manufacturing capacity on the continent? And as we started to do that, others also started to do that, which was great. But then you started having countries that were fighting over which manufacturer were we going to now finance, but we weren't talking to each other. And so that was awful, actually. It was awful for so many reasons. It was awful because you had countries that were fighting to show that they were really, making sure that they were being supportive of building that capacity, but not really understanding what capacity was required. We weren't talking to the WHO. We weren't talking to CEPI. And so these investments were being made without a lot of understanding of what was actually required. And through that, we started to fumble, and then we started to create some learning very quickly. So then in 2021, the DFI started to work together on the Institut Pasteur in Dakar. And I would say that was our opportunity to come together and say, how do we create a capital stack that makes sense for this manufacturer that's been around for a really long time delivering yellow fever vaccine, but could be an opportunity for them to expand that capacity for regional manufacturing well beyond yellow fever vaccine. And so now you have the United States government, who's now has approval to say, yes, we will support this. And now you've got the European Investment Bank, you've got IFC, you've got USAID, you've got KfW, you have just a multitude of both donors and banks saying, let's create this capital stack and work together. But it wasn't like, rainbows and roses. It was really, really difficult. But we created this capital stack during the pandemic for the Institut Pasteur in Dakar, and I would say it's our success story. And so now how do we build on that so that tomorrow we're not stuck in a situation where we're fighting and saying who gets to say we won and we were able to provide that financing, but we're really sort of meeting the partners where they are and what they need, and we're making informed decisions. And so we're in a very different place today. Today we have an initiative called the G7 Surge Financing Initiative. It was a leader's commitment that was made last year in 2023. And we signed a memorandum of understanding just this past September. And it's not like a fluff MOU that's signed between 9 institutions. It's like a substantial, agreement that's signed between 9 institutions saying that we will have financing solutions today that will allow for surge financing tomorrow. And so one of the examples is what I shared with the Institut Pasteur in Dakar. Another example is what we did with Gavi. And that example is literally April 2020, I'm on a call with Seth Berkley saying, we have financing, we know you have a need, how do we create a structure? So even if there's financing, it doesn't mean tomorrow we're gonna go ahead and have a deal. It took 2 years for us to create a structure that made sense for both Gavi and for DFC. So today we have this structure, it's a $1 billion liquidity facility. We have this structure because we worked alongside with another partner, the European Investment Bank. And so now I feel like there's a suite of tools that Gavi has so that when there's an emergency, they're not stuck. They can go ahead and purchase vaccines, whether it's an outbreak, whether it's for routine vaccines, or whether it's for COVID-19 vaccines. And that's what partnership is, and that's what innovation is. So those suite of tools are tools that we use for vaccines. We're hoping to do something very similar for diagnostics. We're working on a term sheet across, again, 9 institutions, not a small feat. But the goal is to have a term sheet ready by next September that's focused on a working CapEx facility. So we're putting our money where our mouth is. And the DFIs can't do everything, but we're saying at least this is what we can do. And then donors need to come in and figure out what they can do as well. Hope that helps. weighs a little bit of the table of what the DFIs are doing. But we're working closely with MedAccess, we're working closely with BII and others, and of course with Gavi at the table too.
This is great. Before we move to MedAccess, I just want to jump from DFIs to philanthropic capital, and we can come back to DFI.
I love the multiple institutions here. Yeah, I think so. When the pandemic hit, we had been operating as a foundation in an issue agnostic way, in a geography agnostic way, and we were in the moment of transitioning to a new strategy based around sort of issue area pillars, and we knew health was going to be one of those, but we actually used in a way, like our opportunity to lean into the moment in 2020 actually really informed the way we developed the strategy. And so I think like one big takeaway for us was just this recognition that there's going to be crises that emerge, unfortunately, from time to time, right? We didn't want to again, we have this long-term sustained change view. We didn't want to find ourselves doing a bunch of new, bespoke, discrete, vertical type of work. Health system strengthening pathways to universal health access really was our North Star, and we wanted to respond to the moment. So one of the things that we did was actually, I think, so this year, our average ticket size is about $500,000 over 2 years. In 2020, we actually dedicated an additional, on top of our regular payout, $100 million just for sort of the pandemic response and health system strengthening work. So again, it's just sort of like leaning into the moment and stretching ourselves out of our own comfort zone. But because our typical way of working has a relatively lower ticket size, we knew we couldn't do it alone. So we were looking for other partners and leaning into collaborations. But a few sort of takeaways just to highlight in the way sort of we started operating and how we stretched ourselves. First and foremost, we looked at what existing infrastructure and partners can we leverage, whether they're sort of pandemics facing or not. Are they in a position to stretch in a way and serve this moment and also incorporate sort of additional tactics into their own work that they could maintain over time? So Village Reach is one of our amazing partners working on the African continent, mostly around sort of supply chain efficiency and sourcing. But in Malawi, they had launched a health center by phone. So a telehealth center. It actually originally started with the goal to serve maternal and child health needs, and it started growing over time. At the beginning of the pandemic, they had actually transitioned the ownership and management of that work over to the national government and the Ministry of Health. And so they were serving more things in maternal and child health, but not getting into early detection and response in pandemics and epidemics, but we saw that there was an opportunity there. So we sort of doubled down, quadrupled down on our support with them, and ultimately that telehealth center became the national, the national COVID 411 line, and really that sort of first response. They've since actually maintained that sort of universal telehealth offering within the country, and they actually even leveraged the platform to start providing virtual training to community health workers, not only in Malawi, but Mozambique and the DRC as well. So again, this is all it was sort of it wasn't a niche product by any means, but it was just this opportunity to expand it in a way that could serve the future of universal healthcare needs. So that's one example, and we've got some others that are amazing as well, but leverage the existing infrastructure, but with that long-term view. The other thing we were really thoughtful about was preventing backsliding as the economy, as quarantines were happening, shutdowns. There, obviously a million challenges popped up, but one of the things, and I know DFC was involved in this as well, so you probably have more to say. But many folks on the African continent receive their healthcare through private services, whether it be pharmacy or just the sort of small local health provider. And so there's this facility called the Medical Credit Fund that had been lending to health-focused SMEs that were serving those populations most in need. And as the economy shut down, there was a risk that those really depending on these services were not going to be able to access them because there were working capital constraints that were popping up. So potential of loans defaulting that these SMEs were, the working capital that SMEs were using, but then also this new increased risk of the medical credit fund looking around and saying, oh, I don't know if I can issue new loans to new partners right now, because things are closed. And so we, along with DFC and others, got together and put together a credit guarantee facility that allowed a pause on interest payments, pause on those loan payments, and more loan dollars to come through. I think in total, we put together $500,000 across the partnership, and that leveraged almost $30 million of lending. So again, so many people would have been without their regular access to healthcare in a very vulnerable moment without that play, and that's obviously such high leverage there. Super. Preventing the backsliding, you have to move fast. Or it's going to be counterproductive. The final point is we really emphasized sort of building and strengthening on coalitions and looking for where are there actors who are either already working together or who might work together even more deeply. So we've made investments over the years in community health workforce, and mostly through individual organizations serving their distinct geographies. At the beginning of the pandemic, some of those organizations had already formed this is where my recall, CHIC, the Community Health Impact Coalition. And so they had formed this coalition recognizing that they, as individual organizations, they were facing systemic barriers that they could not solve on their own, mostly around financing or even sort of global health policy. So they had formed this coalition to help solve some of those issues, but then they, again, at the beginning of the pandemic, sort of doubled down on, well, what more can we do? Who else can we work with? And that led into additional partnerships, working, actually really concentrating efforts to unlock international, multilateral capital and government health resources and helping to channel those into the right places. So that really, the doubling down on the coalitions, I think was another thing that we're taking with us. That wasn't a temporary, experience, but it really shows up in our work moving forward.
Thanks a lot, Liz. Michelle, over to you.
Wow, how do I go after that? I think I thought the three key themes that really cropped up from what you both were saying was collaboration, evolution, and the future, taking lessons learned and transforming for the future. And for us, COVID was just a call to arms. All of us just felt we needed to act, we need to do something. And from a collaborative aspect, from MedAccess, we were fortunate. We had this tool that we call the procurement guarantee. Sounds very specific, but basically it's a very flexible piece of paper. To be honest, I start with a blank piece of paper and I figure out what problems can I solve, and I try to create something that can solve a problem. Mm-hmm. But what was very clear was that no matter what I wrote on this piece of paper, it wouldn't have worked if I didn't work with someone else. Yeah. It needed to be that coordination. So what we did in the midst of COVID was we worked with UNICEF to help support their vaccine independence initiative. That window that UNICEF has really helped to increase the speed and access of developing countries to cold chain support, to vaccines, to testing, to gloves, to PPE. And it was just grateful that we could do it. And when I think about the evolution that led to that, in our organization, we keep a track of how long it takes for us to do a transaction. That by far, or when I see the bar charts, it has been the shortest. So I think all of us responded to that call to arms. And it was great that we found mechanisms by which to respond to that in a quick fashion. And I can go to a little bit of detail because it's quite funny. So I always think about it, which is Pre-pandemic, there was probably an unspoken rule that if you have to do diligence on transaction, you got to be there in person. Now, in the middle of COVID, what the heck are you going to do? And so we find ways of evolving and moving forward. And so now, as an organization, we're at this hybrid stage where you do some virtually, do some, but it just shows that it pushes things forward. So whilst COVID was a tremendous tragedy that happened, we're looking for ways to evolve. And I think one interesting way, because someone mentioned this in the audience earlier today, was it evolved how we thought about risk. Because you now had this one in a, like I said, lifetime challenge. And no one could predict how this was going to evolve, how the virus was going to mutate, how we were going to respond, and how quick our tools were going to come into play. And so as you're sitting there thinking, what can we do in terms of to solve this problem, you also think about the risk involved in putting instruments in place. And we need to change how we thought about risk. We need to change and think about how can we innovatively think about what this risk could be and how to quantify. I mean, how do you quantify COVID and the risk of, will this diagnostic work or will that vaccine work or not? And that was a challenge. It's something that made us a lot more open to how we think a little bit on our feet, how we use perhaps some of the past experiences, but evolved and nuanced a little bit to where we are today. Which then brings me to learning lessons learned. I think it was quite amazing that all organizations jumped in. We're like, hands up, we want to get involved. And I think you mentioned it. We were, probably a little bit messy at the start. We were messy. I'm not denying we were messy. And it took us a while to figure out how different partners were open to doing different things and how we could all work together. And what I like is exactly the MOU that Nafisa mentioned, which is, it's taken us a while. To be very honest, I would have liked us to be a little bit early in terms of putting all these health strengthening systems in place post the pandemic, where at least we still see it in our rearview mirror, so we're still aware and we can move forward. But things like the search financing, things like health system strengthening, the things you mentioned about local manufacturing, it's all very important and are pieces that we're going to try to continue to build on to move us forward, hopefully in preparation for maybe not in our lifetime, the next event they may happen, but you never know. And I like the fact that we are thinking ahead and learning from what we've gone through.
Thanks a lot. And just to react to some of the points that were made, I mean, a lot of the learnings from the pandemic, we're trying to build on to operationalize new structure, thinking it will be useful at some point in time. For instance, at Gavi, we set up something called the First Response Fund, which was created to make capital, at-risk capital, available within 45 days of the declaration of a new emergency by WHO, thinking that it would come to play maybe in a few years. It was approved by a board in June and already drawn down for MPOX in October. So 33 days after the declaration of the public health emergency of international concern by WHO, we approved a drawdown. 40 days after the declaration, we entered into an advance purchase agreement with the manufacturer of the vaccine, and the vaccines are going to be available before the end of the year to the countries for the program. We were not wishing for this to happen so quickly. We're grateful that the instrument was in place, and our fear is that actually there will be more and more such events, and so it's really critical that we're responsive. The other example, building on what you said on regional manufacturing, again, learning from the struggle of African countries to access the vaccines for which they had signed contract and commitments. There was an AU push to localize on the continent 60% of the vaccine production by 2050. And Gavi created a financing instrument called the African Vaccine Manufacturing Accelerator, which basically provides guarantees of very significant payment for African manufacturers when they reach WHO pre-qualification for their vaccines or when they win UNICEF tenders. And these are the things that we kind of build on the learnings from the pandemic, and that we all need to really continue, kind of pushing forward, because it's true that memory sometimes can be short. I just want to follow up on a couple of points, and maybe starting with Liz. You described how Skoll can be very innovative with your investments, and and sometimes at the expense of scale. Philanthropic capital, has the ability to leverage other resources, but, is always operating at a lower scale than, kind of the sovereign funding and so on. How do you manage that tension when striving for large-scale impact? What are the other tools that you use to really kind of leverage more funding and achieve scale?
Yeah, I mean, I think that there's always going to be a trade-off between, I think, speed, scale, and sustainability. And so we're always thoughtful about that with anything that we're supporting, that you just can't have all three at the same time. Oh my gosh, I'm telling you guys, I'm sorry, my brain is mush. But I think, so as we think about scale, we take a really long view. So we're really oriented as a systems change funder. The best sort of studies and examples that we have of systems change is the shortest it will take is about 4 decades. It often takes a lot longer. I see some nodding heads here. I also see a 5-minute before Q&A, so get your questions written down if you're writing them. And so we try to take the long view and not look at things have to scale immediately right now. One of the companies that we have invested in, starting in West Africa, is called Pharma. At the time we invested in them, I think it was 2019. They were primarily focused on supply chain efficiencies for private pharmacies. So typical pharmacist goes to school not to manage a business and procurement challenges and to get meds on their shelves, but to provide pharmaceutical services to their customers. And so they just recognized this sort of skills mismatch, and they're like, well, we'll take that on. I think it's 90% of most of Africans receive their primary health care through their local pharmacy, and they're mostly really small shops. So they sort of made an efficient supply chain, and then they started buying other pharmacies. And then the pandemic came, and they started sourcing testing kits and vaccines and working with, getting involved with the ministries of government as a private player. They're now working with the Lagos state to provide pharmacy-first healthcare, and they've actually incorporated that into the national health insurance scheme. So this sort of pattern of operations for this one company, which, by the way, now is the largest private employer of nurses on the continent, we could not have imagined they would be doing this just 5 years ago when we first invested in them. And in fact, they bought their first pharmacy chain called Halston's about 6 months after we made our investment, and I was like, please don't do this. Please don't do this. No, they were breaking our model and our diligence and our whole investment case, and I was like, I don't know if my stakeholders are going to be good with this, but they've been wildly successful. So I guess it's, again, take the long view, recognize that it's a winding road, and try not to be prescriptive as a partner, and stay flexible for what might come.
Thanks a lot. In the interest of time, I'll move us on to the next question. But I mean, for me, there are a few key takeaways from this segment of the conversation, and to use Michelle's word as collaboration, evolution, learnings. We also heard about leadership, making the announcement before, kind of having everything figured out, leaning in and doubling down. I think persistence and kind of resilience are really, really critical. Just one more question before we move to the Q&A. So you all operate with somewhat different approaches to investing for impact. How do you see these different models, kind of interact for greater impacts? That the sum is greater than the parts. You started talking a little bit about this. Can you tell us more about this? And maybe we can wrap up also with those remarks. Kind of what are you most excited about? What's what's coming up for you? Let's start with Nafisa.
I'm actually most excited about the fact that since we got to work with all these different DFIs and multilaterals, and with grant making institutions, we know what our tools are, and so there's an opportunity for us now to move much more quickly on a transaction. So now I can call up and say, you know, hey, MedAccess, can you do this transaction with us? We think it's really super exciting. And 5 years ago, that never would have happened, and we would have struggled, or maybe we wouldn't have done that transaction. And so to me, I'm just super excited about the fact that we can do much, much, much more because we're working with partners like MedAccess, and maybe, you know, like EIB, like Skoll Foundation. So for me, I'm excited to see what's more to come, aside from obviously the surge financing work, which has been my baby for the last 2 years. Aside from my other 2 children that I actually do have.
Michelle, do you want to comment on that?
Echo exactly what Nafisa said. You know, now we're seeing each other's names a lot more, the phone calls, because one thing we, you know, in the experimental process through COVID, we realized what our limitations were. And I think all of us here are actually, I think what has been our benefit is that we've been really humble about what we can or cannot do. We all know we have different strengths with different weaknesses, and the ability to call on different people has just been really helpful. From a personal level, I'm very focused on non-communicable diseases, just because I think there's been a lot less focus there. So, you know, like, I just want to kind of break barriers as we go along. And some of the diseases that are just underfunded and under-noticed, like sickle cell. So things like that interest me personally, but we'll see where we get to, yeah. Oh, yeah, dengue, yes.
Let's get excited about dengue and NCDs.
Speaking of all of the things, that's where I was going to go. So about half of the world's global population live in countries that spend more on their annual debt service than they do on health or education services combined. All of the things are necessary, right? And I think, Michelle, to echo your point, we can't all do all of the things, but if we know our relative strengths, what we have to offer, and we work in partnership and collaboration with others who can round us out and fill in, I think that's really the most important part of solving or working towards universal health coverage. It's everything. It's public, it's private, it's philanthropic. And so I would just encourage thinking about what are all of the resources that you have at your disposal. As funders, we can write checks. We're primarily a grant maker, but we've been leaning in more and more on, you know, different ways to deploy returnable capital. The example I gave earlier about the sort of the SME finance play, we got about 80% of our dollars back because we came in with risk capital, and so you know, you don't always get 100% of that back, and that's okay. But we actually we flipped that right away back into a grant to the organizing sort of architecture that created that entity in the first place. And so just again, like leverage. Think about all of the tools and resources, and your non-financial work as well. So you know, we host a big convening in Oxford each year. You know, there's just the privilege of who shows up in those rooms sometimes can create space to have a private lunch that turns into I think almost $1 billion now, 2 years later, in funding that's been unlocked through the global fund architecture and system. I mean, and literally it was just getting the right people in the room, all aligning on what we need to do and the urgency, and you know, setting the same goals together and the same timelines. So just do it all, because it's the need is there, and it will be there for some time to come.
Thanks a lot, and I think this is a great segue. We're going to go into the Q&A, but you know, the emphasis on the network, the collaboration, establishing the relationships, and leveraging all the different sources of financing, and also the voices, the non-financing instrument is really, really important. And just to give an example of what we are excited for at Gavi, we're in the process of setting up a new innovation scale-up fund. We've been working with innovators for a long time, and we see that they can be very successful and very impactful at scale in 1 or 2 countries. But then there are a lot of barriers for them to scaling beyond that. And the new fund that we are putting together will combine catalytic capital, so catalytic grants, impact investing, We're looking at things like returnable grants as well, so different instruments, as well as mentoring and support to the innovators, with some of them non-financial. We think that we need to bring all these different sources of funding and other skill sets together if we really want to change how things are done right now. Moving to our Q&A now, invite you all to submit questions. There are little cards that you can write your questions on, and then they will make their way on the podium. The first question is for Michelle. What aspects of the UNICEF COVID experience could be replicated to increase the speed of MedAccess future transactions? And please continue your org's evolutions.
Wow, that's a really good question. There were a lot of learnings that I took from that. I think the first was that we needed to be flexible as an organization. And I think COVID actually granted us that little umbrella to be flexible. Because I probably got away, never quote me when I say this, but I probably got away with a little bit more than I would have under normal circumstances. But then when the organization looks back, it goes, actually, there were relatively good calls made in those times, and it meant that I could push my boundaries further. And so what I'm doing with every deal that I try to do is I try to push and push and push. And that's important for me, because that evolves what we can do, because we want to actually lean into risk. But sometimes, it's more difficult it's easier to say it than it is to execute it. And so that umbrella of COVID was actually a boon for me. So hopefully what we can do is we can think about, one is from my perspective, the speed with which we executed a transaction. We're now thinking, why can't we do that for all these other transactions? Some of them may be more complicated, and we can think about that and we can refine that. But the other is just sort of saying, look, just continue to push the envelope. Yeah.
Thank you. Any other question from the audience? Yeah, you don't need to write. You can stand up and tell us what's, or comments or reflections on what our panel said.
My question was, have there been models from other areas, not the health sector, that you were looking at and could adapt in these situations? Or did you have to make it from scratch?
At least for us, it's interesting. We had, in the manufacturing space in particular, there's a VP that's been at our agency for 30 years, and he's seen a lot. And he really could not, in all of his years, see something that was similar, at least not during the pandemic. And so we really have been creating something that just doesn't exist, period. Even with this MOU that we're talking about, I connected with our National Security Advisor, our Deputy National Security Advisor, our G7 Sherpa. We spoke to Italy as well, because they were leading the G7 this year. Nothing across other sectors. The closest was an agreement from the DFIs on Ukraine and their work with Ukraine and financing projects, but nothing else. And so this was really something that we were creating from scratch, and even this working CapEx facility. I think, Augustine, you've been in some of these conversations. Definitely MedAccess has been in these conversations for sure. We're creating something that doesn't exist. And I think that that's the beauty of it. But and the beauty of it is that we're still engaged, which is interesting, at the highest levels. We're rolling up our sleeves. And at UNGA, we had a closed-door meeting. And I said to everyone at the beginning of the meeting, like, if you've ever wanted to be part of a startup, this is your opportunity. Roll up your sleeve. This is what we're doing. So we're creating something that hasn't existed, at least in this surge financing space. One of the things that we're trying to do, and I'm curious to see if anyone has any thoughts, it was a question that came up, could we leverage what we do for crop insurance for vaccines? And I haven't gotten a response yet, but that's like the new thing that I'm trying to think about. Could we, look at what we're doing in ag and maybe apply it here? But I haven't heard any interesting examples, but happy to hear from the audience if you have any ideas.
Liz, Michelle, do you want to come in?
Go for it.
Well, it's funny you mentioned crop insurance, because it's what came to my mind is it's not necessarily from others. It is from other sectors, but there's ways of unlocking more that we definitely look across sectors to do. So especially when we're thinking about things that get into the public good space. So as it relates to trying to get onto a government budget line item, that's a very hard thing to do. But we have organizations who have done this in the education space or in the agriculture space, unlocking subsidy. And so we do spend a lot of time connecting those dots and those partners for the tips and tricks and the pathways. Ministry of Education is not the same as the Ministry of Health, but they all have to somehow channel to the Ministry of Finance. Exactly. And I'm telling you, like, we don't want everyone to have to recreate the wheel each time. So there's like almost like approach patterns that can be sort of leveraged across sectors we've seen that really then create a shortcut. One of our newest partners is called Food for Education. They're working in Kenya and doing school feeding work. They were connected with some of our other partners to try to unlock government support and subsidy for that work. And they, gosh, not even a year and a couple months ago, just started that in Nairobi, and they scaled from 250,000 meals a day to 1 million meals a day in a matter of months. So that opportunity is just so big. The other thing I would say is how to lean on, influence the global flow of dollars. So we partnered with an organization who was mobilizing forces around localizing development aid in Washington, D.C. Over the past 2 or 3 years. And we just this year sort of used that as our own model for, well, who's the entity who might be able to do this around the global health infrastructure and funding. There's all sorts of replenishments that are necessary, and again, just an additional flow of dollars needed in the health space. And so we've sort of mapped that same pattern with another organization and hoping to see what might come in terms of, replenishing PEPFAR, for example, and then the knock-on effects that we hope will come on the impact from the back end of that.
Sure, anything to add? So we're getting to the end of the panel, and just maybe one reflection from me on this kind of learnings from other sectors on a slightly different level. I think one of the really interesting questions for the global health sector is climate finance. Health is a very climate sensitive issue, and many health interventions like immunization, but like others, are climate adaptation solutions. It's kind of, if you want to build the resilience of communities or help them adapt to climate change, you need to strengthen health systems and deliver a number of essential interventions. And so I think a question for us is, how do we work closely with the climate finance community, where we know that adaptation funding is very small compared to mitigation today, but how do we grow that pie, and how do we make sure that health, health interventions are part of that pie, which is going to be absolutely critical. So just to wrap up, I think really fascinating discussion. Thank you very much, and thank you to all our heroes here who are here for the penultimate session after lunch. This is, thank you so much. I think we've highlighted some great progress that has been made, and we know there's a lot more that needs to be done. I just want to leave the conversation with three key takeaways. I mean, for me, the first one is, what we heard about the importance of collaboration and I would say blending efforts and finance, and creating the networks and the relationships that will help us come up with the new ideas to respond to the evolving challenges. The second one is that there's no innovation without risk, so we need to change our appetite for risk, how we assess risk, and maybe kind of relax a little bit that approach. And then the third one is that finance is not the only thing. I mean, there are a lot of everyone in this room has voice, influence, the ability to convene. And that can create the solution of tomorrow. And so it's great to be part of SOCAP. It's great that the Skoll Foundation and Skoll Forum also, kind of are looking at these issues, and we look forward to a lot more of these conversations going forward, and new innovative initiatives being launched and delivering the impact that we want.